Hello, everyone. I'm Dr. Sheila Nambiar. I'm an OB/GYN and a lifestyle medicine physician. And this is the TFL or Training for Life channel. The objective of this channel is to help you to live a better quality life and to take health into your own hands, be proactive about your own health. And in this, keeping this in mind, I talk to many physicians across many specialties to discuss how we can use our own lifestyle habits to increase and improve our quality of life and our longevity. Today, I'm really, really happy to have Dr. Soham Patel, MD. He was born and brought up in Ahmedabad, India, and is an alumni of the PJ Medical College in Ahmedabad. He moved to the US thereafter and pursued a residency in internal medicine and then a fellowship in endocrinology. Pursuing the quest to treat the patient as a whole person and not just a set of symptoms, he got board certified in lifestyle medicine and now runs his lifestyle medicine focused endocrine practice called the Center for Preventive Endocrinology and Nutrition in Tampa, Florida. Thank you for joining me, Soham. I really appreciate your time. Today we're going to talk about our thyroid gland, and interestingly, the minute I sent out the information that we were going to discuss the thyroid gland, I had a whole host of questions about the thyroid, hypothyroidism, and the various symptoms, etc., etc. So I think this is going to be a really interesting conversation. So let's just start, Soham, by could you explain to us what is the thyroid gland, what are the hormones, how is it controlled, and so on?
Thank you, Sheila, for doing this and having me on your YouTube channel for this wonderful discussion. Um, and just a disclaimer, I think everybody knows it, but just want to put it out that whatever we're going to discuss for the next hour, it's for information, for education purposes. It's not to be used as any professional medical advice. Obviously, you want to seek care with your physician and there'll be a lot of information that you can gain and then use that to further your care. So thyroid is getting more and more attraction because we are seeing a huge amount of thyroid disease around the world. I see it all the time here, but back in India, my friends, extended family, you hear about that more and more often now. And so, if we start with very basics, thyroid is a gland, an endocrine gland, meaning it releases a certain type of hormone, which then does actions at different parts of the body. So, the difference between an endocrine and an exocrine gland means endocrine means it can go to different places away from the gland and still have an impact through that hormone, whereas exocrine means it is just released in the vicinity of that gland and it has effect right there. So thyroid being one of the endocrine glands that sits right at the base of your neck, it's a little butterfly shaped gland with two lobes and a little connection called isthmus. Sometimes there is a little third lobe in the middle. Um, that gland produces a hormone called thyroxine, and thyroxine is produced in two forms. There is the T4, and then there is the active form, which is called thyronin or T3. Now, the size of the receptor or the place where this thyroid hormone binds is on the DNA inside our cells. So, DNA being such a tight space, thyroid hormone has to only have three iodine molecules, which is the T3. So every T4 molecule, which is thyroxine that the gland produces, majority times, 80% is produced as T4 and 20% is produced as T3. Eventually, inside the cells, through an enzyme called deiodinase, that T4 turns into T3 and then it sits on, goes to the DNA, binds to the receptor, and it does a series of chemical changes that produces different proteins which then leads to different effects on different organ systems. So, if I broadly list different effects, thyroid hormone is very important in maintaining our body temperature. So, if you don't have enough thyroid hormone, you tend to feel more cold. You get cold hands and feet. On the contrary, if you produce too much, you sweat more and you feel like you're burning up, or your body temperature may run a little 9900 range. It is very important to maintain normal brain function. So if you don't have enough thyroid, you feel like you're not able to think properly. You forget things easily, and if you produce too much, then you just cannot shut off your thinking. You feel like you cannot sleep because your thyroid is just pumping all this hormone, and you feel on the edge all the time. You feel anxious. There have been many times where a person with overactive thyroid has been diagnosed because they ended up getting admitted in a psychiatric unit with maniac episode, and thyroid labs were checked and they found out that they were in a very frank state of overactive thyroid. So thyroid has a variety of changes, and on the other extreme, you can end up in a coma called myxedema coma in the ICU because your thyroid levels are completely low, and your brain cannot function, your body doesn't function. Thyroid has an effect on your heart. Heart function needs optimal thyroid levels. If it's too much, your heart can start beating too fast. There is a condition that involves with change in the electrical pattern of the heart called atrial fibrillation, where the top chamber of the heart called the atria starts doing this instead of pumping like this. So when you do this, you don't pump enough blood, and that can cause your heart rate to go up. If you don't produce enough thyroid hormone, then your heart cannot pump well. So it starts pumping slow, and it can start building fluid around the heart, which can cause issues with your circulatory system. Going down to the gut, our gut motility, the pace at which our bowels move, is controlled with thyroid. So if we don't produce enough, then we get constipation. If we produce too much, then we get frequent bowel movements. So every time you eat, within half an hour or an hour, you have to go, empty your bowels. And it's different from diarrhea. Diarrhea is where you don't form, proper stools. You form loose stools or you form watery stools. This is actually technically called hyperdefecation. Defecation is, having a bowel movement. So you're actually having frequent bowel movements, not necessarily diarrhea. And that's because your gut motility is very high from excess thyroid. Um, I briefly talked about sleep. So you could sleep too much if you're not making enough thyroid hormone, and you don't feel enough energy because you're not producing enough energy in the cells where also the thyroid hormones are connected with metabolism. And if you produce too much, then you have too much energy or you are not able to sleep at all. With too much thyroid, you could be having a voracious appetite and you eat a lot and you still lose weight. Or on the other side, you may not eat much and still gain weight because of the change in metabolism. Your nerves can get affected. Underactive thyroid can typically cause a lot of tingling, numbness in your hands and feet. Your skin can get affected. You get very leathery, rough skin when the thyroid is not
1 minute, Soham, when you say underactive, you mean a hypothyroid.
hypo. I'm using this generic terms because hyper sometimes gets too technical, so I'm just so
Okay.
underactive means hypo and overactive means hyper. And if you produce too much, then you may get sweaty skin, and you can have issues because of that. Um, so thyroid has a lot of I just enumerated. Maybe I missed a couple or so, but lot of different systems in the body are affected or controlled by thyroid hormone, and when you have an imbalance, you start seeing issues one side versus other.
So have you noticed, Soham, that I don't know if it's just a question of of diagnosing more thyroid disorders? Or have you noticed that there are more, that the incidence of hypothyroidism has gone up? And we are seeing a much higher incidence of people every second person, I mean, not second person, but the incidence of people who have a low active thyroid gland has gone up considerably.
So there are two parts to this. Number one, we have better laboratory assays now, which are very sensitive, that can measure TSH, which is thyroid stimulating hormone level that the pituitary gland releases, that controls the thyroid. So the TSH assay at one point, many, many years ago, could only measure up to 20. So anything below 20 was not measured. So 20 was a cutoff for normal thyroid function. Then came an assay which could measure up to 10. Then came an assay which could measure up to 5. And the latest, fourth generation TSH assays can measure up to 0.006. So one aspect is where we are now able to measure better, so we are also able to detect better. But that's a very small aspect. I think we are truly seeing an increase. I don't think we know, because the data shows that there is a true increase of thyroid issues that we are seeing across the world. And there are a few reasons for that. If we talk about underactive thyroid or hypothyroidism, which is more prevalent than overactive thyroid in my clinical observation, the underactive thyroid can happen from a few different situations. Low iodine, which since salt has been iodized, has been tackled to some extent, but there is still a lot of subclinical iodine deficiency, meaning it's not low, but it is not optimal. So getting your iodine level checked to see where it is can help you, see where you stand on the iodine level. That's playing a role over here. And I think also in India, there is an autoimmune condition called Hashimoto's. Hashimoto was a Japanese scientist who described this many, many years ago. And Japan has a lot of thyroid disease prevalence. So what happens is your immune system, it's called an autoimmune condition, meaning your immune system is acting up on itself and attacking tissues which are not necessarily foreign, but it is making proteins against it called antibodies. And those antibodies are damaging the thyroid in the process. Now, there are a few situations why that happens. Mercury, which if you have too much mercury, seafood has a lot of mercury, or people get this old amalgam teeth fillings which had silver and mercury. Those type of things can cause mercury to go and sit on your thyroid, and mercury elicits a very strong immune response. So mercury could be causing your immune system to causing antibodies, but it's not the thyroid itself, but the thyroid gets attacked in the process and gets damaged. There is a virus called Epstein-Barr virus, which typically causes a condition called infectious mononucleosis. Teenagers can get affected with it typically, but it can also happen later in life. And if you have that viral infection, the viral structure is very similar to the thyroid cell, some of the proteins. And so your immune system may produce antibodies against the virus, which may in turn attack your thyroid. Or you could just have issues with, dairy, milk, and milk products causing an immune response, and that immune response attacking your thyroid in the process. Fourthly, certain types of wheat, especially the ones that are highly hybridized and have very high gluten content, and your gut is having issues with inflammation. I know I'm kind of going into very detail, but I think if I don't explain this basis, then we are missing out a lot of things. So quickly talking about leaky gut, when we get exposed to pesticides and heavy metals and all this animal foods, animal protein, we cause our lining in the gut to become very porous. Usually it's very tight junctions between the cells, but then it becomes loose. And now you have bigger protein molecules passing through and activating your immune system around the gut. So that's where we see the connection with gluten and thyroid antibodies. So with those situations, you can develop antibodies against your thyroid, and then it causes your thyroid to have swelling, more blood flow. Over time, it slowly destroys your thyroid gland. So the key process with Hashimoto's is to recognize it early on, to have labs checked for thyroid peroxidase antibody and thyroglobulin antibody. Those are the two different thyroid antibodies that you want to get checked. And if you do find that they're positive, there is value to make lifestyle changes early on and reverse it from getting worse. If you don't address it then, and it's 10, 15 years and you've been on a thyroid medication, and your thyroid gland has been completely destroyed, which you can see on an ultrasound when you do an ultrasound of your thyroid, if the gland is completely black and there is a lot of change in the texture, that means the gland has been destroyed. So coming off thyroid medication in that aspect is usually not, feasible. But if it's early on and the gland is still viable and you're just seeing the beginning of the process, you can actually make lifestyle changes, which we'll talk further, and prevent it from getting damaged further. The second aspect of underactive thyroid that I'm seeing, which I don't think there is as much acknowledgement of that, but this is my clinical observation, is anybody who has insulin resistance, which again, a big term, but basically what it means is your body is not able to utilize the insulin like it normally should, which leads to pre-diabetes and then diabetes. But anybody who ends up with diabetes, I typically find within a year or two, their thyroid number starts going up. And they have to be put on thyroid medication. And that aspect, the thyroid dysfunction because of insulin resistance, can be reversed if you reverse insulin resistance. And I don't think there is a time limit on that. So even if it's 10, 15 years, but if your thyroid is primarily underactive because of too much insulin pumping around that is interfering with your thyroid hormone signaling, then if you reverse insulin resistance with the lifestyle changes, which we'll talk, which by the way are not different, what you do for insulin resistance is very helpful for the thyroid as well. You can reverse that. And the third one, as I talked, there is a degree of iodine deficiency. So if you are clinically iodine deficient based on a lab, serum iodine level, then replacing 100 to 150 micrograms of iodine as a liquid supplement will be, a good idea. There are certain food sources that have iodine. So seafood and dairy typically has iodine, but there are also the foods that are not good for your thyroid. There is a plant-based source of iodine, which is I grew up in Gujarat, so we call it Singoda. It's called water chestnut, if I'm correct. It grows under the water like a lotus, and has this white colored fruit with a very hard exterior. So once you roast it, and then once you open up the exterior, it has this nice tender white fruit inside, which is a good source of iodine. But if you don't have access to that in your area, then I think checking the level on a lab, and if it's low, then taking 100 to 150 micrograms. Keep in mind it's micrograms, not milligrams. Micrograms of iodine would help to replace that deficit.
So do you recommend an iodized salt, for instance, for everybody across the board?
So like we were chatting just earlier, pink salt or rock salt is also quite popular, lately. But it's been used for centuries in India, and that has more minerals, but unfortunately, it's deficient in iodine. And sea salt, which is iodized, will get you the iodine. So what we do for our household is we get iodized sea salt and we get the pink salt, and we kind of combine both 50-50.
By
So we,
in your family?
Mhm.
Okay. Okay.
And that's how. And another thing, which is a cooking tip, is don't add salt earlier in the cooking process. Add salt right before you're about to finish the cooking for any dish that you're putting salt in. So number one, you'll require a lot less amount of salt. You'll get more flavor, and thirdly, you will not evaporate most of that salt away if you put it early on in the cooking.
Right, right. So typically, Soham, when a patient is diagnosed with hypothyroidism, they are given the thyroid supplements, thyroid hormone, the thyroxine supplements. So is it mandatory that this has to be is a lifelong process, or is there a way of reversing the disease where you don't need to take the supplements?
So, like we talked earlier, depending on what's the cause, will determine how the course is. So, if it is early onset Hashimoto's, that it's been just maybe 6 months, a year, maybe a couple of years, and yes, there has been some inflammation on the thyroid, but the gland has not been completely destroyed. If you make lifestyle changes, you can actually reverse those antibodies and allow your thyroid to go back to normal and not need lifelong thyroid hormone replacement. If it's coming because of the thyroid, because of insulin resistance, like we talked about, reversing insulin resistance can also, help you come off the thyroid medication.
Right.
And even in situations where it has been 20, 30 years of Hashimoto's and the gland has been destroyed, but if you make lifestyle changes and you are able to lose weight, because thyroid is a weight-based dose at that point, you can actually reduce the requirement of your thyroid hormone, not necessarily come off of it, but you can definitely reduce the dose to a large extent. So what are the lifestyle changes I keep talking about? So they are very simple, but they're geared about four aspects, mainly speaking. We can add more, but four broadly speaking. One is your nutrition, the type of food you eat. Second is your sleep quality. Um, Third is your stress management. And fourth is, are you trying to reduce the exposure to toxins? So I talked briefly about the mercury in the metal, in the amalgam fillings. So if you have any amalgam fillings, you want to probably have them safely taken out, not just randomly drilled into, because you'll release more mercury. So safely taken out with high vacuum technique, and replaced with a composite non-BPA filling, making sure you are, not eating foods which are high in heavy metals. So seafood, unfortunately, is very high in heavy metals. So avoiding that, and also making sure that you are having a good intake of cilantro in your daily food. Cilantro has chemicals which can allow our liver to chelate heavy metals. So chelation means combining those metals, and then they can be excreted out of the body. So the reason why cilantro has a very metallic taste is because it has those nutrients which can help capture heavy metals and get rid of, from the body. Parsley is another similar, herb, but cilantro, I think, or dhania, as we call it in India. Dhania is the herb that you want to definitely eat on a consistent basis. Some green juices in form of celery, mint, dhania, little bit of lemon, ginger, that could be also a good way to help you detox. You don't have to do it on a daily basis, but maybe periodically once or twice a week, having 4 to 6 ounces of that could also be quite potent for detoxification. While I'm on the topic of detoxification, I'm also going to touch about the amount of radiation we are exposed to and the radiation that we are exposed to on our head and neck area with typically the cell phone. EMF, electromagnetic field radiation, and definitely with the 5G, which is such a quantum jump into this unforeseen energy level that we're going into, it's going to affect our whole body, but definitely the thyroid because we're doing this all the time. So investing on a good cell phone cover that can block much of that EMF radiation, or having this little tags. I think Modi is a company that produces tags with that can block EMF radiation that you put on the back of the phone. That's the one I saw that when I was in India a couple of years ago.
Does it help to use the Bluetooth?
So Bluetooth, I don't think we have enough studies to look at what's the effect of Bluetooth on our body. We know about EMF. The reason I actually changed after into this is, a wired connection is better than a Bluetooth in my mind. But I think Bluetooth may be better than just constant exposure. But again, I don't know if information to give you a specific answer there. But that's just from cell phone. But we have TV, we have iPads and laptops. Laptops should not be put in the laps. They should be at least a foot away from you. So those kind of toxin exposures you want to limit as much as possible. Sleep, very important. I think one of the questions was sleep. So if you do not have one proper night's sleep, just one night's sleep deficit can upregulate up to 700 different inflammatory genes in your body. So in other words, it stimulates your genes to start producing proteins which cause inflammation in the body, which is not good, which damages your thyroid and a lot of other organs in the body. So making sure that you are trying to go to bed by a decent hour meaning by 10 p.m., latest by 11, nothing beyond 11, and trying to limit blue light exposure before you go to bed, because there's blue light from all these devices I just mentioned can actually kill the melatonin that the brain releases which allows you to fall asleep. So limiting blue light for at least an hour or 2 hours if possible before bedtime, and relaxing, having a soothing routine like listening to music or some light reading, taking a warm shower can allow you to fall asleep better and have better sleep quality. So making sure your sleep routine is good. You can sleep 7 hours, but if you sleep 7 hours after midnight, it does not have the same effect as if going to bed by 10 p.m. So the time of the sleep and the quality of the sleep are both very important. If you get interrupted because of whatever reason, it affects your sleep quality, which leads to inflammation, which affects the thyroid. Stress, again, leads to high cortisol levels, which is another hormone that the body produces, which is necessary, very necessary. If you don't produce cortisol, you will die within few minutes. But if you produce too much, then your body also has effects from it. And thyroid can definitely have issues with high cortisol, which interferes with functioning of the thyroid hormones. And finally, the biggest impact that happens is food. So I talked about dairy briefly. So milk has casein, and the saturated fats both tend to trigger thyroid, issues. So avoiding milk, cheese, butter, yogurt, those type of foods. Cheese, unfortunately, because of westernized food patterns in India, has become a big problem. Cheese used to be a special meal when I grew up, but by the time before I moved to US, I was already seeing that cheese was becoming a very predominant part of our cuisine. And unfortunately, now kids don't eat traditional Indian foods anymore. They want to have everything with cheese and everything that's westernized, and that's a big problem. That's actually leading to diabetes blowing up for kids and adults. Secondly, we talked about gluten. So you don't have to be a fanatic about avoiding gluten. Gluten mainly comes from rye, barley, and wheat. Wheat is the predominant source. But if you try to limit the amount of wheat and have other, grains, I think there are so many types of millets which are available in India. Ragi and, all the other ones, fox millet. Millets are great grains, so that's a good replacement for wheat. Having brown rice and not white rice instead of, you know, white rice, have brown rice. Um, I think oats are now prevalent. They're available now, but oats, wholesome oats, rolled oats, or still cut oats are also a good grain. So limiting the dependence on wheat as a source of grain, or just rice as a source of, especially white rice, having brown rice instead of white rice is
Yeah,
one aspect.
yeah, if you think about it, in India, especially in North India, wheat was very, very prevalent. The consumption of wheat was the norm. So how, and this is a question that I get very often, especially from people from North India. When we are inherently adapted to eating wheat, why are you now telling us not to eat wheat? Why are you talking to us about gluten allergy? Which is a very,
Yeah,
right?
we have not. I think socio-culturally traditions we have made wheat our predominant source of grain, and then the farmers also have transitioned into growing just wheat mostly. But if you go back just 50, 60 years ago, or if you go back 100 years ago, there were a lot other grains which were grown and not just wheat. um, I think I'm not wrong if I say there's an area around Nasik in Maharashtra where they used to grow nachni, which is a type of millet, which has, now I think the farmers are starting to grow that back again. But it's a very dynamic process. I don't think it's a static process. So, and it's also good for the soil. If you just keep growing one type of, plant in the soil, you deplete it, and that's where you need all these fertilizers. So if you rotate the crops, and you get the variety for your health, and you also make sure that the earth also gets the nutrients. Again, that's a whole big topic I don't want to digress into, but
So
um,
what you're saying is that when we eat, also we need to eat a diverse array of grains, vegetables, fruits, and not be fixated on one particular
yeah.
thing. Is that what you're saying?
Yeah, and so one is a variety of the grains. Like if I talk about Gujarat, there is a kodri, then there is a tandra, which is type of millets. There is bajri, which is obviously millet. There is Rajagro, which is also another type of millet. So there are so many different grains. I'm just talking about one region. So every region in India has some inherent local, grains and fruits and vegetables. So making use of that variety is very optimal. And then I can definitely tell you what I've seen in Gujarat, that there is predominance of grain intake, and obviously fried and snacks and all those other things. But grain intake is more so the base than vegetables and beans and lentils. They are there. I'm not saying they are not there, but their proportion, if I see, uh, is very smaller. So the other change that you want to work on is increasing the intake of vegetables, beans, lentils, and fruits, and keeping grains as one small aspect of it. So if I give you a percentage, 50% should be vegetables and beans and lentils, and not just one dal, but variety of different dals and the different beans.
Yeah.
When you sprout your beans, it's even better. And 25% should be fresh fruit, and only 20 to 25% should be the grains, which you should try to be make it more variable. And
Yeah,
a handful of nuts and seeds like almonds and walnuts.
yeah. I don't think this is only in Gujarat. This is across, at least across India for sure, because what we find is that the main source of the calories as well as the nutrition, I mean, quote unquote, nutrition comes from the grains. And unfortunately, most of it is refined. It's white rice, it's refined wheat. So
Maida.
that is where the problem comes. And then you have the added oils to make the rotis or the different flavored rices. So I think that's where the problem comes. So the restriction of the vegetables and the fruit and the beans and the nuts and seeds, whereas you have an overconsumption of the refined grains with added fats and sugar, of course.
And that's where you get that, notion, or eating vegetarian or you're not going to get any protein. Well, if you're just eating refined grains and processed grains and all those oils, and you're not eating enough fruits, vegetables, and beans, you're
Yes.
not getting enough, balance of the macros. So it's not that eating vegetarian or plant-based is deficient in any way, but eating it in an unbalanced manner with eating a lot of grains and especially processed grains and
Yes.
using other things as a side dish is where the issue comes up.
Problem comes. Yeah, yeah. So there was the other question I wanted to ask you is, you've addressed sleep and you've addressed nutrition. How is thyroid health related to cardiac health? Are there an increased incidence of cardiac?
So, like I was telling earlier about the thyroid, effects. If it's not enough, you could get issues with swelling around the heart or cardiomegaly, as we call it. Or there could be too much thyroid, and you get these rhythm abnormalities where your heart is beating too fast and not beating properly, and your heart rate goes up. So, there is definitely close connection there. But there are a couple of things that I do want to make sure we don't forget. So low vitamin, I talked about insulin resistance, as a cause of thyroid dysfunction. But low vitamin D is also a very common cause of thyroid dysfunction, because low vitamin D, not just for bones and muscles, but it also is necessary for better immune system. So there are two aspects of our immune system. One is the infection control arm, and other is the allergy response. And we need balance between the two. If your vitamin D stays low, and anything below 40 nanograms per ml is low in my clinical observation, and also there are other studies which back that up, uh, is not enough, and so you'll be exposed to more infections because of low vitamin D. And at the other end, you will have hyper response to different autoimmune conditions and allergies. So people get a lot many food allergies, and then they get thyroid and lupus and rheumatoid and all kinds of autoimmune conditions because of low vitamin D. So vitamin D supplementation should be focused. You check your level, and if it's anything below 40, you should take vitamin D3 supplements. Maybe start with 2,000 units without any calcium daily with dinner, and then if it doesn't come up, you can go up to 5,000 units. But making sure you're looking at the level and adjusting the supplementation. So that's really important. And the second thing in terms of vitamins or minerals is selenium. We talked about iodine as an essential mineral for thyroid, but selenium is also a very essential mineral for different reactions in the thyroid hormone production. So selenium is found in there is a nut that is from Brazil. It's called Brazil nut. It looks very similar to akhrout, or the walnut in the external structure, and then once you break it, it has this long oblong nut that is very high in selenium. One nut has about 150 micrograms of selenium.
It's
So
not,
what I tell my patients here is to
yeah, but it's not easily available in India, Soham. So would you have a substitute? Is there
yeah.
a substitute in
So I'll have to actually dig further and find out. There are other foods too which have selenium. I think beans also have selenium, but what's the proportion? I'm not fully updated with. Um, So you can take a selenium supplement. The only issue with that is if you overdo it, then it can affect your liver and kidney function. So you want to be very judicious if you get a supplement. I think with the advent of this e-commerce over here, the supply is in the stores is kind of variable, but I easily can find them on Amazon. So I have my patients order a bag of Brazil nuts on Amazon, and you just need one Brazil nut a day.
Okay, okay.
You don't
So,
need a lot.
so your diet is extremely important. Your sleep is extremely important. Stress levels, you have said, is extremely important. Have you come across instances where the thyroid goes, out of function because of stress, because of acute or prolonged stress?
I've seen that happen more so with overactive thyroid. So there's a condition called Graves' disease, which is an autoimmune condition again on the overactive spectrum of thyroid. And there is again your immune system making certain proteins called antibodies, and that attacks your thyroid. But it in this situation actually stimulates it to keep producing more thyroid hormone, and you end up with overactive thyroid. And it can also cause your eyes to pop out because of growth of tissue behind the eyes. That's Graves' disease with ophthalmopathy. So in that situation, it can also affect Hashimoto's too over time. But if it is Graves, it definitely has a huge connection. I have patients who, have controlled things with their food changes and getting their vitamin D level up, taking the Brazil nut, and their antibody comes down, and I'm able to get them off their methimazole medication. But then they go through some stressful situation, and the thyroid acts up again, and I have to, put them back on the medication while they still work on the stress issues of life, and eventually I can get them off again if they go through the process. But any kind of stress, acute and obviously chronic, can definitely trigger the thyroid.
Yeah. There are a couple of questions, Soham. So, how do you test for thyroid antibodies? When do you test for thyroid antibodies?
So yeah, I'm glad that question comes up because we haven't talked about what lab assays to check. So typically, only TSH, thyroid stimulating hormone, is checked for thyroid function most of the times, but I think it's changing now. But in my practice and my approach, I think you should be checking TSH, free T4, free assay of T4, not the total, and free T3. All three of them together to see where they are, and you're really looking for optimal reference. So if I give an example, TSH has a range of 0.5 to 4.5. Now, TSH of 1 is very fine, optimal, but I find some people, they find it too much, especially if they're on thyroid hormone. Some people don't feel normal when the TSH is 1. They feel better when the TSH is around 2.5 or 3. Versus some people feel worse when it's 3 and they feel better when it's 1. So every person has a different equilibrium, so to speak, of thyroid hormone levels. But also looking at T4 and T3. So if your TSH is let's say 3, your free T4 is the range is 0.8 to 1.8. Let's say your free T4 is 1, and your free T3, which is the range, is typically 2.2 to 4.2. On your free T3, the range, your level is 2.5. You see that your TSH is 3, which is on the higher side of the range. Your T4 is on the lower side of the range. T3 is, but it is not optimal, is what I would say. So if they are on a medication, then I would adjust the dose to try to get the TSH near 1 and the T4 near 1.2, 1.3, and the T3 near 2.8 or 3. So trying to get it in the middle of the of the range, and typically people feel better when that happens. So working with each patient, so you'll be working with your physician to have them check those levels, TSH, PT4, PT3, and then trying to optimize the levels and not just say it's normal.
It's within the norm. Yeah.
And the antibodies that we talked about, so there are two: thyroid peroxidase antibody, and it's typically called TPO antibody. Some labs also run it as a thyroid microsomal antibody. So both are the same, it's just different names. And the second one is called thyroglobulin antibody. Those two antibodies are again blood test. They can be drawn right along with the TSH, T4, T3. And then if you don't have had done, getting the iodine level done, serum iodine level done to see where you stand on the iodine and your vitamin D level. So checking those, three different aspects of labs: thyroid panel, antibodies, iodine, and vitamin D level can kind of give you a very good indication of where you stand.
Okay. So there is a question: if a person is diagnosed with a thyroid problem, I know the skin and hair can get ruined, but with treatment, can it regain its lost health?
It can. So, getting back the levels, with the right dose is one aspect of it. But also, as you change your food habits, as you avoid dairy, as you avoid predominance of just wheat and gluten, and start adding more fruits, vegetables, and beans, your body gets better nutrition. See, if you go back to Ayurveda, it's very consistent thought process that our hair, skin, and nails are reflection of our internal health and nutrition. So if your internal milieu and nutrition is not right, you would get issues even without thyroid problems. So thyroid can make it worse, but there are two aspects to it. One is getting your thyroid levels appropriate, and second is working on your nutrition, which also helps to nourish your hair, skin, and nails.
So it would be safe to say, Soham, that even if you have a hypothyroid, if you've been diagnosed with hypothyroidism and you are being given the thyroid hormone to stabilize your levels, you still need to implement your lifestyle changes in order for you to get the optimal skin and hair and all of that, isn't it? Just giving you the hormone is not going to reverse everything.
Yeah, it fixes a lot of things, but it doesn't completely address the root causes. It's like we are putting a band-aid on things. We are not really addressing the root cause. The root cause is issues with your sleep, your stress, your nutrition, and those toxins like we talked about. So if we address those, then we can actually address the root cause. And if it's early on, we can come off the medication. If it's too late, we can still get to a proper dose and still feel optimal. So whichever situation you are in, there is definitely value to investing in your lifestyle changes.
And also what I'm hearing is that the since you're saying that, when you make these lifestyle changes, you actually may need the requirement for your thyroid supplementation may decrease, because your lifestyle changes may be adding to the benefits. So which means that ideally you need to be going back to your physician and reviewing on a regular basis. Am I right? So because dosing.
Yeah, you want to have periodic follow-up. So depending if you are making intensive changes, you want to probably get it monitored every 2-3 months to keep a close watch, so your dose can be adjusted accordingly. And if things get steady, then you can ease off to maybe 6 months or something like that. But while you're making changes, you want to have a closer watch every 2-3 months with lab work, and see your physician with that.
There's another question: can thyroid lead to skin pigmentation? I guess they mean hypothyroid.
I think the insulin resistance actually leads to more pigmentation issues than the thyroid itself. Thyroid kind of makes, if it's underactive, your skin is more, rough and leathery feeling and dry. and cracks up a lot. Which if it stays chronically, then you may get some, changes in the skin color. Um, but I think insulin, if you're talking about darkening of the skin, I think that happens more from insulin resistance. You may have seen it commonly, uh, and I find that in people from Indian descent and people from African descent is when we develop insulin resistance. And that's even before, on the labs that you were told to be diabetic or anything like that, or pre-diabetes. Typically, people have blackening of the side of their face. Their face starts getting black here or on their forehead, or they get blackening on the back of the neck, which is more common. But this is very specific for people from Indian descent, or also on the side of the cheek here. And that itself is a telltale sign that your body is completely insulin resistant. And so if you have that, that's a warning bell that you need to work on lifestyle changes and not wait till your doctor tells you, no, you're pre-diabetic or you're diabetic.
Yeah, yeah. So there's another question. Can you feel shaky when you have a problem with thyroid? It's probably hyperthyroid.
Yeah, hyperthyroid can make you feel shaky. You get tremors because you feel like you're wired up a lot. But even with hypothyroidism, you could feel shaky if your sugar drops too low. So, like I told you, thyroid has an impact on metabolism. It can also affect your sugar numbers. So, underactive thyroid can actually put you at more risk of low blood sugar, hypoglycemia. And too much thyroid hormone from the overactive thyroid can actually cause you to become diabetic, even if you may not be diabetic. So, typically, when someone is overactive and I get the levels optimized, their sugar numbers normalize as well. So you could get shaky from just too much thyroid. That is the effect on the nervous system. But you could also get shaky from low sugars that can happen from underactive thyroid.
Okay. There's another question. TSH has come to normal after it was around 14, only on a minimal dosage of 25 micrograms now. It was 50 for 2 months and now 25. But its levels are continuing. Is there a question? Can you recommend a good physician in Bangalore? Okay. I don't think Soham can.
I think Sheila should. No, I don't know anybody in particular. I think you may know more, for physicians who may be lifestyle minded that can actually work with you. But if I can answer that question they're trying to ask is, so, initially if your levels are off and you put on thyroid hormone, yes, within a few weeks, a few months, your numbers will be better and you may be able to lower the dose. But don't get happy at that point. You really want to use that as a warning sign to make lifestyle changes and potentially be able to come off the thyroid medication completely and not say, okay, things are fine, I just keep taking this. Because what's going to happen is if you do not invest on lifestyle changes, then after a few months or a year, your numbers will change again. So your doctor will change your dose back to 50. And then after a few months, a year, your numbers will change again. So then your dose will go up to 75 or 88. So if you do not make the changes, although numbers may be better for a while, they may keep going up because it's showing that your thyroid is getting destroyed behind the scenes. And we are not recognizing that fact, and it eventually leads to higher doses.
Yeah. So, yeah, the same person says, Mubin says, I was pre-diabetic. I was on metformin for 4 years, but now no medication. Something 1 year normal. Yeah, well, end of the day, Soham, I think what the message that you are trying to get across is that it's not just about treating the thyroid deficiency with the supplement, but to add your lifestyle changes, which may sound very simple. What you recommended didn't sound very dramatic. The simple changes in your diet, keeping your dairy, eliminating dairy if possible, increasing the vegetables, increasing the fruit, beans, seeds, nuts. What about exercise? What would you have to say about exercise? Does it have an effect
Ac-
on the?
Activity is good in general for anybody. The reason I did not include it in the aspects to change is people then feel there is too many things to do and they feel not motivated to take the steps. So the reason I focused on those four is because those four have the biggest impact. Exercise is good for anybody. I'm not against exercise, but if you're trying to work on improving your thyroid, I think nutrition and sleep and stress management are the three areas. And then you also focus on avoiding toxins or detoxification with, some green juices. And as you do that, you're going to feel better. You're naturally going to be feeling like going and, jogging or doing some exercise. So that will come naturally when you feel better, you have more energy, you're going to be more active and you'll do things. Not just, you don't have to go to the gym or exercise, just working in your yard, working with your plants, doing some yard work. That's a lot of exercise. I can tell you, if you just a little bit of yard, you do manual weeding, it's a lot of exercise. So,
Well, yeah, but Soham, the thing that I'm seeing here in India is that we are not as physical as we should be because we have a lot of help. You see, we don't do the yard work, like you said. We don't do the physical work in the house, like you said, like we used to. So, as a result of which, we need to actually come up with ways of being physical.
I think it's a perspective. I can tell you, I grew up in Ahmedabad. We had a lot of domestic help. We had a staff of 5, 6 people. But I can tell you that all of us, my parents, my grandparents, and myself, we all still had the mindset that you should keep doing things. So yes, we had a gardener to tend
Yeah.
to our, gardens and everything around the house. But it was my grandfather, always made sure my summer vacation, every morning I had to wake up at 7 because 7 is when the water supply came for half an hour. So I had to make sure I wake up at 7 and water the plants from 7 to 7:30. So you could have a lot of help, but I think if you keep a mindset of
Yes. So the
keeping
conscious
yourself,
mind. So it's a conscious mindset, wouldn't you say? It has to be something that you really, especially because it's not the norm. It's something that you really need to focus on and try and implement. Movement, not necessarily exercise, but movement is something that you would need to try and really incorporate into your daily life, because otherwise we're just sitting around like we are now,
something
just sitting
something very simple, I can tell you, which gives you a whole body exercise. If you just do Surya Namaskar, right? Surya Namaskar has, I think, a lot of different steps, right? Which involves a lot of motions through the body. And this particular motion, when you're doing this with that legs extended phase, you also allow your thyroid to get some activity. Doing 10 Surya Namaskars a day is a great start and only requires 10, 10, 15 minutes.
Absolutely. Yeah.
We have the wisdom in our culture. It's just, are we going to apply it or not? That's what it turns out to be.
Yeah. Yeah. So just one last question, Soham, because we've been going on for so long.
Sure.
There is one that says, are hypothyroidism patients prone for anemia?
Yes, if you are chronically hypothyroid and not properly managed, the levels are off. That's the effect I forgot to mention. So thyroid is also essential to maintain your bone marrow production. So if you don't have enough thyroid hormone, then your bone marrow will not produce enough red blood cells and sometimes even white blood cells. So low thyroid states can cause anemia on a chronic basis. And there are other reasons too for the anemia, but thyroid and anemia
Yeah.
can be connected through that.
Okay. Okay. So, so yes, we will have to wind up here because it's more than an hour. Thank you so much, Soham, I really, really appreciate the time that you've taken out to talk to us about thyroid, and I hope that the message that has gone across, which Dr. Soham Patel has been trying to emphasize, is that despite the fact that there may be a problem, it may be a hyperthyroidism or hypothyroidism, there are certain things that one can do to be proactive about one's own health in terms of your nutrition, your diet, your sleep, and your stress, primarily in the case of thyroid, which can improve the condition of your thyroid functioning. So I hope you will take those things seriously and put it into action in a way that can help you not just with your thyroid, but generally with your well-being. Thank you again, Soham. Please do subscribe to the channel to receive notifications about further conversations like this, which are just going to explore the various aspects of health, especially when we can be proactive about our health and take things into our own hands and improve health and longevity. Thank you, Soham. Do you have any
No, if I can just, so my last summary would be, don't take medications as your destiny. They have a purpose, they have a benefit, they can help you, but there is more in your hands, in your lifestyle changes that you can transform your life and potentially come off them in a very safe, monitored manner. So don't take things for granted and apply things with, you know, more power to you.
Thank you so much, Soham.
Thank
Very,
you.
yes, a very, very informative session. Thank you, and thank you all for joining. Bye-bye.
Thank you.